The truth about vasectomy. Does it affect erections or desire? Debunking myths and explaining the procedure. Afraid of a vasectomy? You've probably heard stories or warnings about this procedure, that it affects sexual performance, diminishes masculinity, or even makes desire disappear. Let me be clear from the start. Most of what you hear is false. Hello everyone, I'm Manuel Granada, a specialist in the care and well-being of older adults, and today we're going to become detectives of our own health. Vasectomy is one of the safest and most effective forms of birth control available, and yet mistrust persists. Our goal today is simple: to separate fiction from science. We're going to explain exactly what it is, how it works, and most importantly, we're going to debunk, with scientific evidence, the myth that this procedure affects your sex life, your erections, or your desire. If you're considering this option, or simply want to be well informed, stay with us. It's time to learn the truth about vasectomy. The origin of the myths. Where do the misconceptions come from? Before delving into the science, we need to understand the context of the myths. Why does such a simple surgery generate so much anxiety? The myths about vasectomy stem primarily from two sources: anatomical confusion and cultural expectations surrounding masculinity. Anatomical and functional confusion. Many people confuse the function of the vas deferens, which are cut during a vasectomy, with the function of the testicles, which produce hormones. Common myth: a vasectomy stops the production of hormones or semen. The reality: a vasectomy only interrupts the path of sperm, the fertile component of semen. Semen, seminal fluid, continues to be produced in almost the same quantity by the seminal vesicles and prostate gland. Most importantly, the production of testosterone and other male hormones occurs in the testicles and is not affected at all by the blockage of the vas deferens. This lack of distinction leads to the mistaken idea that something essential to manhood or sexual function is being completely eliminated or blocked. The cultural and psychological burden. In many cultures, fertility is directly equated with masculinity and sexual potency. A man's decision to undergo a vasectomy is, essentially, a decision to end his reproductive capacity. The psychosexual link. The fear that a vasectomy will affect erection, erectile dysfunction, or desire, libido, is often a somatization of anxiety about the perceived loss of his role as a father. The body responds to the psychological fear: if I can no longer procreate, will I cease to be a strong or desirable man? Specific myths. From this arise myths such as sexual pleasure decreases, ejaculation will be painful or dry, I will become less attractive to my partner. These fears, although unfounded, are very real for the individual. Part of the pre-vasectomy medical consultation should include an open discussion about these anxieties to ensure that the decision is based on logic and not fiction. Now that we have identified the roots of the myths, it is time to understand exactly what happens during the procedure. A vasectomy is a minimally invasive medical procedure and, from a surgical perspective, remarkably simple. Its name comes from the vas deferens, Latin for vas deferens, which are the focus of the operation. A. What does a vasectomy involve? A vasectomy is a permanent method of contraception that works by interrupting the flow of sperm from the testicles, where they are produced, to the urethra, where they mix with semen and are ejaculated. The sperm pathway. Sperm are produced in the testicles. They then travel and mature in the epididymis. From the epididymis, they travel through the vas deferens, a thin, muscular tube. The vas deferens joins the ejaculatory duct, where fluids from the prostate gland and seminal vesicles are added to form semen. Semen is then ejaculated. The surgical procedure. A vasectomy blocks the pathway at the point where the vas deferens joins it. It is usually performed under local anesthesia in a urologist's office and takes about 10 to 30 minutes. Conventional vasectomy. A small incision is made with a scalpel on each side of the scrotum. The surgeon isolates each vas deferens, cuts a small segment, and seals or ties off the ends, using sutures, cauterization, or clips. No scalpel vasectomy, NSV. This is the preferred method today. It uses a special fine-tipped instrument that pierces the skin with a tiny hole. The vas deferens is then isolated through this small opening and sealed in a similar manner. NSV results in less pain, less bleeding, and a faster recovery than conventional vasectomy. What happens to the sperm? Sperm continue to be produced by the testicles, but now they have no outlet. The body naturally reabsorbs them, a process that normally occurs with old cells. This is a common biological process and does not cause blockage or harmful buildup. Purpose and benefits. The primary purpose is permanent contraception. However, its benefits and advantages set it apart from other methods. Superior effectiveness. Vasectomy has an effectiveness rate of over 99%, rivaling tubal ligation, but is a much simpler and safer procedure. Simplicity and safety. It is an outpatient procedure with a very low risk of complications, mainly bruising or minor infections. Cost effectiveness. It is a one-time, long-term investment, proving much more economical than years of using birth control pills, injections, or IUDs. Advantage over condoms. It eliminates the need for contraception at the time of sexual intercourse, although it does not protect against STIs. Advantages over tubal ligation. Female contraception. The female equivalent is tubal ligation. It is crucial to compare these two sterilization procedures. Clearly, if a couple has decided on permanent sterilization, male vasectomy is the safer, simpler, and less invasive option of the two. The impact on daily life and sexual function. Now we come to the most important point. How does vasectomy affect a man's daily life, and in particular, his sexual function and satisfaction? The short answer, supported by decades of research, is that vasectomy does not negatively affect erections, libido, or sexual pleasure. The physiology of sexual function. Vasectomy is not castration. To debunk these myths, let's review the basic physiology. Erection. This is a neurovascular process, involving nerves and blood vessels. Sexual stimulation sends signals to the brain, which in turn sends nerve signals to the penis, releasing nitric oxide. This relaxes the smooth muscle of the corpora cavernosa, allowing for a rapid influx of arterial blood. Cutting the vas deferens has no connection to this vascular or nervous system. Sexual desire, libido. This is primarily determined by testosterone levels in the blood and by psychological factors, stress, relationship status, body image. As mentioned before, vasectomy does not alter the production or release of testosterone from the testicles. Ejaculation. The volume and sensation of ejaculation remain almost identical. Semen, ejaculate, is composed of more than 95% fluids from the prostate and seminal vesicles, and less than 5% sperm and testicular fluids. Without sperm, the total volume is reduced by a minimal amount, imperceptible to both the partner and the man himself. The sensation of orgasm is produced by muscle contractions in the pelvic floor, and this is not affected in the slightest. Post-vasectomy changes. The positive impact. Far from being harmful, many studies indicate that vasectomy can have a positive impact on couples' sex lives. Reduced fear of pregnancy. This is perhaps the most significant sexual benefit. Eliminating the constant anxiety about an unwanted pregnancy allows the couple to relax and focus entirely on pleasure. This often leads to an increase in the frequency and quality of sexual relations. Improved relationship. By sharing the responsibility for contraception on a permanent basis, many couples report a stronger bond and greater mutual satisfaction. The man takes on a proactive role in family planning. Quick return to sexual activity. Although it is recommended to wait a week after surgery to avoid infection, the return to sexual activity is usually quick. It is crucial to remember that a man is not immediately sterile after a vasectomy. Residual sperm remain waiting in the ejaculatory ducts. Standard protocol. Another contraceptive method must be used until the urologist confirms azoospermia, absence of sperm. Semen analysis, spermogram. This is generally performed 2 to 3 months after the vasectomy and after 20 to 30 ejaculations. Only when the semen analysis confirms 0 sperm is the man considered sterile. To finally dispel the myths, let's see what major health organizations and peer-reviewed studies say about vasectomy and long-term health. 1. The cancer myth. The myth: vasectomy increases the risk of prostate or testicular cancer. The evidence: this myth has been categorically refuted by large-scale studies. Key study, 2014. A large meta-analysis published in the Journal of the American Medical Association, JAMA, that initially suggested a very slight risk was reviewed and contradicted by subsequent studies. AUA, American Urological Association, and NCI, National Cancer Institute, consensus. Both organizations have concluded that there is no proven causal relationship between vasectomy and an increased risk of prostate or testicular cancer. Routine cancer screening remains the same for all men. Vasectomy is not a risk factor. 2. Erectile dysfunction and libido myths. The myth: vasectomy causes impotence, erectile dysfunction, or reduces sexual desire, libido. The evidence: the medical literature not only refutes this, but often reports the opposite effect. Sexual impact study. Multiple follow-up studies have shown no significant change in testosterone levels after vasectomy. Meta-analysis on sexual function. A systematic review of studies on post-vasectomy sexual satisfaction found that most men and their partners reported improved or unchanged sexual function, citing the freedom from worrying about pregnancy. The psychological factor, the nocebo effect. In the rare cases where erectile dysfunction is reported, urologists often attribute it to a psychogenic factor, anxiety and fear, rather than a physical defect, something that can be managed with therapy or counseling. 3. Myth of chronic pain, PVPS. The myth, vasectomy always leads to chronic testicular pain. The evidence, post-vasectomy chronic testicular pain, PVPS or post-vasectomy pain syndrome, is a rare complication. Incidence, significant chronic pain requiring treatment occurs in approximately 1% to 2% of cases. Management. In most cases of postoperative pain, it is mild and temporary. Persistent cases can be treated with medication, or in rare cases, with another procedure. The risk is low, and the urologist should discuss it as part of the informed consent process. The facts are clear. Vasectomy is a highly effective contraceptive method that does not compromise sexual function, pleasure, or hormone levels, nor is it causally associated with serious long-term illnesses. We've come a long way. We've debunked the irrational fears surrounding vasectomy, understanding that they are based on misinformation and cultural anxiety, not science. Vasectomy is a simple, safe, highly effective, and, in some cases, reversible procedure, although it should be considered permanent. It does not affect testosterone production, nor does it diminish pleasure, desire, or erection. In fact, by freeing the couple from the worry of pregnancy, it often improves the quality of their sex life. If you are considering this option, speak with a board-certified urologist. Make an informed decision based on the evidence we have presented today, not on myths. Thank you for joining us. Until next time.